Welcome to our channel. Today, we're diving into an important health topic that affects millions worldwide: arthritis. We're going to break down the barriers surrounding this condition, taking a look at what it is, why it happens, and what you can do about it. Whether you're dealing with arthritis yourself or know someone who is, this video is packed with valuable information to help you better understand this condition. So, let's get started on feeling better and living our healthiest lives. So, what exactly are we talking about when we say arthritis? You see, the word itself is kind of a blanket term. It's used to describe over 100 different conditions that affect our joints, causing pain, stiffness, and sometimes even making it tough to move around the way we want to. That's right, over 100. Now, the most common types you've probably heard of are osteoarthritis and rheumatoid arthritis. Osteoarthritis. That's the one we often associate with wear and tear as we age. It's like that old saying, "I've got sand in my joints." Well, it's not really sand, but it can feel like it. Rheumatoid arthritis, on the other hand, that's a whole different ballgame. It's an autoimmune disease, meaning the body's own immune system, the one that's supposed to protect us, mistakenly attacks the joints. This causes inflammation, pain, and over time, it can even lead to joint damage. But hey, don't let these big words scare you. We're going to break it down and make it easy to understand. Now let's talk about the signs and symptoms. How do you know if it's just everyday wear and tear or something more serious like arthritis? Well, the most common symptom, and the one that usually sends people running to the doctor, is joint pain. And this pain, it's not always a constant thing. It can come and go, be worse in the morning or after you've been active. Sometimes it might feel like a dull ache, other times it's sharp and stabbing. Along with the pain, you might also experience stiffness in your joints, especially first thing in the morning. It's like your body just doesn't want to cooperate. Then there's swelling, redness, and warmth around the affected joints. This is a telltale sign of inflammation. And in some cases, you might even notice decreased range of motion. Like, you used to be able to touch your toes and now you can barely reach your knees. Not cool, right? But here's the thing, everyone experiences arthritis differently. Some people have mild symptoms while others have more severe cases. The key is to listen to your body and pay attention to any changes you notice. If you're experiencing any of these symptoms, don't brush it off. Schedule an appointment with your doctor to get a proper diagnosis. Now, I know what you might be thinking, Dr. Mike, this is some serious stuff. How long can someone actually live with arthritis? And that's a really important question. The good news is that for most people, arthritis doesn't directly translate to a shorter lifespan. It's not like you're going to get diagnosed and boom, your time is up. However, it can significantly impact your quality of life if left unmanaged. Think about it, constant pain and stiffness, not being able to do the things you love because your joints are screaming at you. That's no way to live. But here's where things get hopeful. With early diagnosis, proper management, and a little bit of effort on your part, you can live a long, fulfilling life with arthritis. We're talking about lifestyle modifications, medications, maybe even some physical therapy. It's all about finding what works best for you and staying proactive with your health. Remember, knowledge is power, and the more you know about your condition, the better equipped you'll be to manage it effectively. So, what causes arthritis? Well, it's not always a simple answer. You see, it's often a combination of factors like genetics, lifestyle choices, and even environmental triggers. Let's start with genetics. Some people, they're just genetically predisposed to developing certain types of arthritis, like rheumatoid arthritis. It's like inheriting your mom's eyes or your dad's sense of humor, except in this case, it's a predisposition to joint problems. Not exactly the kind of inheritance you want, right? Then there's lifestyle. Being overweight or obese, that puts extra stress on your joints, especially those weight-bearing joints like your knees and hips. Over time, this can lead to wear and tear, increasing your risk of developing osteoarthritis. And speaking of wear and tear, repetitive stress from certain jobs or sports can also take a toll on your joints. Think construction workers, athletes, even those who spend hours typing on a keyboard. All of these can contribute to joint problems down the line. And let's not forget about environmental factors. Exposure to certain chemicals and toxins has been linked to an increased risk of developing some types of arthritis. So, it's important to be mindful of your surroundings and take necessary precautions. Now, I know what you're thinking. Dr. Mike, this is a lot to take in. Is there anything I can do to prevent this from happening to me? And the answer is a resounding yes. While we can't control everything, especially genetics, There are definitely some things we can do to reduce our risk of developing arthritis or at least slow down its progression. First and foremost, maintain a healthy weight. I know you've heard it a million times, but it's true. Losing even a small amount of weight can make a big difference in reducing stress on your joints. And how do you maintain a healthy weight? Well, it's all about finding that balance between a nutritious diet and regular exercise. Speaking of exercise, let's talk about that for a minute. Regular physical activity is crucial for maintaining joint health. Now, I'm not talking about running a marathon here. Start slow with low-impact exercises like swimming, cycling, or even just taking a brisk walk in the park. The key is to find something you enjoy and stick with it. Exercise not only helps strengthen the muscles surrounding your joints, but it also improves flexibility and range of motion. And trust me, your joints will thank you for it in the long run. Now let's talk about food. Believe it or not, what you put on your plate can actually make a difference in your joint health. We're not talking about miracle cures here, but rather about making smart choices that nourish your body from the inside out. So, what are these magical foods? Well, let's start with fatty fish like salmon, tuna, and mackerel. These guys are packed with omega-3 fatty acids which have powerful anti-inflammatory properties. Think of omega-3s like little firefighters, putting out those inflammatory fires in your body. Next up, we've got leafy green vegetables like spinach, kale, and collard greens. These nutritional powerhouses are loaded with vitamins and antioxidants that help protect your joints from damage. And let's not forget about nuts and seeds. Almonds, walnuts, chia seeds, flax seeds. These little guys are packed with healthy fats, fiber, and antioxidants, making them a great addition to your diet. But hey, it's not just about adding certain foods, it's also about limiting others. Processed foods, sugary drinks, excessive alcohol consumption, these can all contribute to inflammation in the body, which is bad news for your joints. So make smart choices, listen to your body, and remember, you are what you eat. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more health tips and information. Stay healthy. Remember, knowledge is power when it comes to your health. We're in this together, striving for healthier, happier lives. Take care and see you in the next video.